Hey there, I'm Joshua Johnson. It's good to be with you on this Tuesday, December 21st. Here is some of what we're talking about tonight.
So I'm announcing today the federal government will purchase $1.5 billion, that's not million, billion with a B, additional at-home rapid tests with delivery starting in January.
The president is taking steps to fight the Omicron variant, but many testing sites are struggling to meet demand. Will relief come soon enough? The pandemic has undoubtedly been hard on many relationships, but some couples are saying that it has actually strengthened their bond. We'll get into the research on love, sex, and COVID. Plus, workers at Kellogg's reach a deal to end an 11-week strike. One of the union reps joins us live. And it turns out the revolution was televised. Sesame Street changed much more than our ability to count and spell. We'll preview a new documentary on the show with the actress who played Maria for more than 40 years. Well, a lot is happening today and what seems like every day with the Omicron variant. We don't want to overwhelm you with every little detail, but we will sum up the president's address to the nation because today he laid out how his administration plans to tackle this new variant. Watch.
Starting this week, the federal government will set up emergency testing sites in areas that need additional testing capacity. We also need to do better with at-home testing. So I'm announcing today the federal government will purchase $1.5 billion, that's not million, billion with a B, additional at-home rapid tests with delivery starting in January. We'll be getting these tests to Americans for free. In addition, I've directed the Pentagon to mobilize an additional 1,000 troops to be deployed to help staff local hospitals and expand capacity.
Now, the president is planning to keep using the Defense Production Act to speed up manufacturing of tests. This law lets Mr. Biden speed up and streamline industrial production for various kinds of national defense. He also said that he wants to set up more vaccination sites. As for the military support, you can see here on the map, the first wave of emergency response teams will go to Michigan, Indiana, Wisconsin, Arizona, New Hampshire, and Vermont. Those teams will most likely be dealing with unvaccinated patients. That trend has gotten even clearer now that more people are vaccinated. President Biden also called out those who refuse to get their shots.
How concerned should you be about Omicron, which is now the dominant variant in this country, and it happened so quickly? The answer is straightforward. If you're not fully vaccinated, you have good reason to be concerned. If you are vaccinated and follow the precautions that we all know well, you should feel comfortable celebrating Christmas and the holidays as you planned it. You know, you've done the right thing. You can enjoy the holiday season.
So yes, we can indeed enjoy the holidays. That's despite Omicron spreading fast, as many experts expected it to. This variant is now dominant in the U.S., according to CDC data. So the key is getting vaccinated and getting tested. But many testing sites are overwhelmed, and retailers are struggling to keep up with demand, as you may have found out firsthand. But let's start there with CNBC senior health and science reporter Meg Terrell. And Meg, based on your reporting, I wonder what you make of the president's announcement today about increased testing sites and increased support to hospitals.
Yeah, so a lot of experts in the space are very excited about this renewed and increased focus on testing, and particularly free testing. Some of that impact we are going to see right away. This week, for example, the federal testing sites, the first ones getting set up in New York City, which can really use it for any folks who live here. Walking around, you see the long lines for people waiting to get tested. But the other parts of this plan are going to take longer, like the 500 million free at-home rapid tests becoming available. That won't start until January, and so that's after a lot of the people are already looking right now to be able to get access to these tests.
Meg, why exactly are we struggling to get tests to everybody? What are you seeing in terms of what the problem is?
So there are a couple issues here, and they're kind of separate from what I understand from experts for the lab tests versus the at-home tests. For the lab tests, you have to actually perform those in a lab. So I'm hearing the biggest issue there is the folks actually doing them, and they're just backlogs because once there's a lot of demand, processing that starts to take a lot longer. When it comes to the at-home tests, it's really the supply chain and being able to ramp that up faster. And then the secondary issue is labor, actually getting folks to be able to staff those plants to make the tests. But both of those things kind of coming together, creating this issue of making it really hard to access these.
How many people are we testing right now, and how does that compare to what we believe that we should be testing? I mean, are we far off from the testing capacity we should have, or are we kind of close?
We're not very close based on what testing experts think we need to get to. So I talked with Mara Aspinall from Arizona State University, a testing expert. She estimates that with the lab tests like PCR and the home rapid tests, many of which don't get their results actually reported to health authorities, we're probably doing about 5 million tests per day already. But with Omicron being so much more transmissible, she estimates we probably need to be doing twice that. So 10 million tests per day, and that'll be a challenge to ramp up to.
I wonder also, with regard to pharmacies like CVS, Walgreens, they announced some limits on how many tests that people can buy. I know that at-home tests weren't really in demand when COVID began, and people felt kind of more comfortable with PCR tests. So this sudden surge in at-home tests, I'm not sure that we're expecting it or that they're prepared supply-wise to deal with the surge.
Yeah, both of these companies warning today that they are kind of dealing with this increased demand and limiting 4 to Walgreens and 6 at CVS. I think it's 8 at Walmart. Essentially, they say they have supply, but kind of shifting that around and making sure they get it to the right places. You are right, though. There was a time when not as many people were taking these rapid tests. PCR was really preferred, but we've seen a shift in the acceptance from public health officials and the general public to finding these really useful. If you can find them, they can be more convenient than waiting in line for a lab test.
And before I have to let you go, Meg, I imagine that the going belief is not that this is necessarily too late, but it might be too little too late, that maybe we needed more tests sooner to kind of prevent us from being where we are with Omicron.
Yeah, that was certainly a criticism of the plan today, and you even heard it in the questions from the press corps to the president right after his speech, asking why we didn't do this sooner. And his argument was Omicron came on really fast. I mean, the speed with which it reached 73% of newly diagnosed cases just blew everybody's minds. But at the same time, we've known testing has been important for a while, and 500 million free at-home tests are great, but we've got 330 million Americans, so experts say we've really got to get a lot more to really make this be helpful.
Thank you, Meg. That's CNBC's Meg Terrell starting us off tonight. Much appreciated. Now, if increased testing and vaccinations make a difference, the nation's hospitals might notice it first. Here in New York, some hospitals have already run out of monoclonal antibody treatments. Those have proven effective against the Omicron variant. Those facilities are unsure when they will get new supplies from federal and state agencies. And concerns about hospitalizations extend beyond the White House to the city that it's in. Washington, D.C. is dealing with nearly 4,000 new COVID infections from just this weekend. This morning, the district's indoor mask mandate went back into effect. And to be clear, this mandate affects municipal buildings, public spaces, private businesses, not federal complexes like Congress or the White House. Just west of Washington is the Inova Fairfax Hospital in suburban Northern Virginia. Dr. Mario Ramirez is an emergency physician there. He served as acting director of pandemic and emerging threats under President Obama, and he joins us now. Dr. Ramirez, welcome.
Thanks for having me, Joshua. It's nice to see you.
Now, your hospital is in, for those who don't know the region, it's in kind of the suburbs west of Washington in Northern Virginia, Fairfax County, in that area, kind of west of Arlington. What are you seeing in your area in terms of how the Omicron variant is affecting you and your colleagues, just in terms of handling the patient load?
Well, so I worked in the ER Friday, Saturday, and Sunday over the weekend, and I will say it is impressive just how many more COVID cases we're seeing. In the last 3 weeks, our daily COVID volume has tripled and the number of daily hospital admissions has increased by just the same amount. And what that does is it creates just an impressive backlog onto the other patients in the emergency department. When I walked in at 7 o'clock in the morning each of those days, we had about 20 to 30 patients who had been there all night waiting to get all of their conditions taken care of. And it's like that in hospitals across the region, throughout the Mid-Atlantic and all the way into the Northeast. And that's really the problem that, the surge in COVID cases creates at this point. The challenge is not just taking care of COVID patients, it's all of the other patients that we have to take care of that we're really struggling to meet their needs at the same time.
Is this where you expected that we'd be a year into the pandemic?
Well, I think anybody who has watched pandemics and tracked pandemics for a long time knows that these things are extremely unpredictable. And I think there is a solid cadre of folks, myself who, are included, who have said that we truly don't know what this particular virus has in store for us. I think the rate that the spike protein on this variant mutated at, has been much faster than we had expected. But what is not surprising is that we're at this place when we have a large number of Americans who have chosen not to get vaccinated, or who have chosen, not to wear masks and do the things that can help prevent spread. In some ways, this is a mess of our own choosing.
What did you make of what we've seen over the last 2 years? Forgive me, I didn't mean to say a year. Time has no meaning in the pandemic, it seems. But I wonder if you think that the president's announcement comes at the right time in terms of what he announced today. What did you make of his plan?
Well, I think there were a lot of great things that the president said today. There were also some areas where I wish that we'd heard a little more. Traditionally, the three pillars for response to an infectious disease like this would be, first, testing, second, treatment, the first would be prevention, the second would be testing, and then the third would be treatment. And on prevention, I think the president's speech today laid out a lot of great ideas about getting vaccinations into arms. But we need to be completely honest with the American public that 2 doses of an mRNA vaccine is not really going to prevent a breakthrough infection in the majority of folks who get them. It will go a long way to preventing serious illness that will put you in the hospital. But a lot of what's driving panic in America right now is people feeling like an infection is just as severe as it was 2 years ago. And that's just not the case. But we need to level with people about the likelihood that they're going to have a breakthrough infection. On the testing piece, I think Meg made the great point that it's excellent that all of these tests are coming to the market. But it's also unclear how all of the announcements today fold into the other testing announcements that the administration has made over the last few weeks, primarily around, whether insurance companies are going to pay for tests that consumers buy on the private market. There are a lot of these announcements that are out there, but not a clear sense for how it's all working together. And we didn't really get much more clarity during the president's speech today. And then on the treatment piece, the part that I wish the president had talked a little more about was first what the supply for that last remaining monoclonal antibody is going to be. And then also what the time course for some of the oral antivirals look like, because those are going to be critically important for us as we get further into this Omicron surge.
I wonder if I could ask you what you're hearing from patients just in terms of particularly those who are unvaccinated, those who have views about the vaccine. The president took aim at those who are spreading misinformation and disinformation about COVID online. Here's part of what he said.
The unvaccinated are responsible for their own choices. But those choices have been fueled by dangerous misinformation on cable TV and social media. It's wrong. It's immoral. I call on the purveyors of these lies and misinformation to stop it. Stop it now.
Dr. Ramirez, are you seeing the impact of this in your hospital? I know that politically, maybe Northern Virginia is a slightly different part. It's definitely a very different part of the state than Central or Southern Virginia. But what are you seeing in terms of how informed or misinformed patients are?
Well, there's certainly a significant breakdown, in terms of the number of patients who come into the emergency department and those who come in really sick. And if we, leave the politics out of it for a second, there's no doubt that of the patients that I saw over the weekend who were really sick, who are going to need to be hospitalized, and probably some who were headed to the ICU, were people who were not vaccinated. And the statistics certainly bear that out. There's no debate about the fact that if you're not vaccinated, you're at a significantly increased risk of ending up in the hospital and potentially a bad outcome. Now, it's also true, the polls clearly show that tracks again along certain political ideologies.
Right.
But whenever I meet one of these patients, they always have the same response when I say, you have COVID, you're going to have to stay in the hospital. And they all seem surprised to find out that it's real, which is unfortunate because this is completely avoidable.
Last thing I would ask you, we just got a statement from New York City Health and Hospitals, which is the public hospital system. It says that it is going to temporarily suspend all patient visits system-wide with a few exceptions, namely for end-of-life visits or if a person is in labor, if an infant's in the ICU, that kind of a thing. This is a pretty severe move that they've decided to take. Dr. Ramirez, do you see your hospital having to take those kinds of moves if things don't improve before we go?
Well, I think if this is about visitors in particular, I think what people need to know is that right now, hospitals are high-risk places. There are a lot of people who are infected with COVID there, and the truth is that if you don't need to be in a hospital for a really good reason, now is not a good time to come. And so if you're a family member of somebody, unless your family member is at the end of their life or there's a really compelling reason for you to be there, I think it's a good decision, and we should be asking those family members to stay home.
Dr. Mario Ramirez of the Inova Fairfax Hospital in Virginia. Doctor, thanks very much.
Thanks, Joshua.
Still to come, we may need to talk more about sex and relationships, especially in this pandemic. We'll get into the research on how COVID has changed dating, marriage, and our connections with just about everyone. We're glad you're with us for Now Tonight from NBC News. We're talking about the efforts to endure the spread of the Omicron variant. For nearly 2 years, many of us have done our part to protect ourselves. Doing that also protects others, of course. But research shows that even keeping safely apart might be bringing us closer together. A recent article in the Wall Street Journal details how the pandemic has affected our romantic and sexual relationships. If the data bear out, they could signal a kind of reset in how we hook up and how we settle down. Joining us now is the author of that piece, Dr. Justin Garcia. He's the executive director of the Kinsey Institute at Indiana University, as well as a scientific advisor to the online dating service Match. Dr. Garcia, welcome.
Hi, thanks for having me on.
Let's begin with some of the findings on marriage. According to your research, about 3/4 of the people you surveyed said the pandemic strengthened their marriage. About 4 out of 5 said it made them feel more committed. Elaborate on that.
Sure. So this was an important study at the start of the pandemic by some of my colleagues at the Kinsey Institute. And what my colleagues found was that in a sample of married people at the start of the pandemic, that a lot were saying that their marital relationships were getting better. Now, at the same time, we did a big study looking at people's sexual lives, a big multinational study at the very beginning of the pandemic, and that was taking a bit of a hit, and we'll talk more about that. But for married people, a lot were looking to their partners and saying, well, my relationship actually got better in many ways. For me, as an evolutionary biologist, that makes sense because it's the very reason we have these intense relationships, the reason humans have had them for over 4 million years, that when the going gets tough, when there's uncertainty, we can turn to our partner for support. And this was the ultimate test for the human animal.
Now, define better in a relationship. I think there's a difference between saying that I'm happier versus saying I'm more stable, but Lord, the old ball and chain. This is what the Lord done blessed me with, and I guess it's better than COVID. You know what I mean? Like, what do we mean when we say better?
Yeah. Oh, I love that you brought this up, Joshua, because one of my pet peeves in relationship science is when people talk about success in a relationship. And I always go, what exactly is your measure of success? What do we think it is? Now, what we do in our studies is we often look at things like satisfaction or happiness or security. Relationship longevity, which is what people often mean, how long you stay together. That's really not a good predictor of how happy or satisfied you are. So in this study, when we say that marriages got better, I'm so glad you asked this. It really is the key question here. It's that people were saying that their relationships strengthened. This is among the married people. They said their relationships strengthened. They felt more committed. And one way to think about it is that this sort of global trauma that everyone experienced, it was relationships that were bad, they got a lot worse, particularly those characterized by any forms of domestic violence. Those people were really struggling. But those relationships that maybe had some of the sort of typical things that all of our relationships have, and over the last year, we've all found reason to be better at negotiating with our partners. those people, for the most part, did better. They said that their relationships, they got better at communicating. Even in our sexual study, a lot of people said it was the first time ever they turned to their partner and talked about a sexual fantasy. People were together for decades.
What about our sex lives? I mean, one of the things that I think some people were presuming is that once vaccinations increased, that people's sex lives would heat back up again. Some people talked about what they expected to be a hot vax summer. I don't know where that term came from, but apparently it was the thing. And I'm not sure that I fully believe that, because I kind of wondered, like, if that would be enough to get over people's fears of, of getting COVID from a random hookup. And I'm not judging people who hook up. Like, that's part of life. But I was never really convinced that that would materialize. And your research sort of bears that out, that not only did it not materialize, but that the tide may have shifted well away from doing that at all.
Yeah, I'm totally with you. And your prediction is right. So I think, and I'm the same. I don't have anything against thinking about variations in people's relationship dynamics. I actually started my career writing a lot about things like casual sex and casual dating, and when that does or doesn't lead to intimate relationships or romantic dating. So we fully recognize that that's part of the diverse tapestry of people's intimate lives. But what we saw in the data was at the very start of the pandemic, and some of the data we collected at the Institute, at the Kinsey Institute, was that there was a decline in frequency of sexual behavior. That was for people of all demographics, that sexual frequency declined. Now, that was very much because of the stress and the anxiety and the unknown aspects of what everyone was dealing with. But to your point, the question was, well, what about a year later? What about when vaccines were available? Everyone was predicting that there was going to be this sort of new roaring 20s as people were emerging and coming back to life, and their sex lives were heating up. The problem with that is that it suggests that everyone was comfortable again, and it suggests that nothing happened over that last year. What I think happened actually is this major reset in our dating culture, in our dating lives. And I think it's a pattern that's being driven by the young. So when we look at the data, it's Gen Z and millennials who are telling us that they're the most interested in more meaningful relationships. I think you had the stat up before, 62% of singles in our sample of over 5,000 singles we collected said they're seeking a more meaningful relationship. That's driven by younger generations. So it's not to say that people aren't having casual sex. That hasn't gone away. But what it is to say is that there seems to be this greater focus than what we've seen in the past on building close relationships, getting to know someone, to support each other in our romantic and sexual lives.
Before I have to let you go, you noted some of the top traits that were articulated in a potential mate. Those now include trust, communication, and open-mindedness. Your study also noted more singles prioritizing self-care. And we got a voicemail from a listener to this effect. Here's what Gloria in the U.S. Virgin Islands left in our inbox. Listen.
The coronavirus actually improved my love life. I took a lot of time out to work on me and see things that, I had issues with and where I would be a problem in a relationship. And I met a guy, and because I took the time to work on me, I see improvements. I see longevity. I see happiness.
Good for you, Gloria. Best decision he ever made. Congratulations, best of luck to you, and thank you for leaving a message for us. Before I have to let you go, Dr. Garcia, I wonder where you see this going in terms of our overall balance between conventional relationships and our sex lives. It feels like the pendulum keeps swinging towards more relationships at one point and then towards more of a libertine sexuality at another point. And I find the people that are the happiest, at least that I know, are the ones who struck the balance, the ones who are really honest about who they are sexually and find relationships that validate that instead of saying, oh, this is the time I'm supposed to be more committed. Okay, I think it's safe for me to be a little bit more of a, an ethical slut now. Like, that feels really unhealthy. Are we getting closer to a middle ground where we kind of own all the pieces of our intimate lives, or are we still kind of going back and forth? Before I have to let you go.
Oh, thank you for bringing this up. I mean, I think we can only hope. And I do think the data is starting to tell us that people are taking more seriously the role of sex in their intimate lives. We know that sex and sexual behavior is a part of that, and talking openly and honestly with our partners, that only helps a relationship. Now, there is a subset of people who really don't want to talk about it, and if they get pushed to, it could be a real danger for their happiness and satisfaction in their intimate life. But for the most part, those honest conversations, and I think what the pandemic has done is had all of us are having more honest conversations. We're doing it with ourselves, just like the caller Gloria said. I mean, 2/3 of single Americans in our sample said they're taking their better care of their mental health and well-being. We're having these conversations with ourselves. We're also having them with partners. People appear to be more upfront on a lot of the dating apps about what they want, what they don't want, what they're willing to settle for, what they're not willing to settle for. Yeah. I think this is a positive turn in our lives, and particularly in our intimate lives, about exactly as you said, being honest about who we are, the things that we want, the things that do and don't work. I think that's a good trend if we can figure out how to openly communicate about love and sex and intimacy and marriage. It only gets better from here.
Well, I would love to keep talking more about this, particularly how this communication trend shapes itself when we're under less dire circumstances than a pandemic. But for now, I'm really grateful that you helped us dig into these results. Dr. Justin Garcia, the executive director of the Kinsey Institute at Indiana University. Dr. Garcia, thanks very much.
Thanks, Joshua.
Up next, another union reaches a deal, this time with the company behind cornflakes. Workers at Kellogg's ended a long strike today. We will get into what sealed that deal with a union leader in Omaha when we come back. In some ways, 2021 might feel like the year of the union. Workers across the country are seizing this moment to demand better pay, new benefits, and more job security. The latest development involves the company that makes cornflakes. The union representing employees at Kellogg's has voted to ratify a tentative contract. Labor reps say the deal involves no concessions on the part of their members. In early October, 1,400 members went on strike. They worked at cereal plants in Omaha, Memphis, Lancaster, Pennsylvania, and the company's headquarters of Battle Creek, Michigan. You will meet one of those workers in just a moment. Kellogg's chairman and CEO Steve Cahillane said that he is pleased to have reached an agreement. He added that he looks forward to the workers returning after Christmas. Joining us now is Daniel Osborne, the president of the Omaha chapter of the Bakery, Confectionery, Tobacco Workers, and Grain Millers International Union. That's the union representing these workers at Kellogg's. Mr. Osborne, welcome.
Thank you, Joshua.
We should note we did ask Kellogg's to make someone available for an interview. The company said that no one was available, but of course our invitation stands. Mr. Osborne, let me start with you and your reaction to the deal that was reached. I gotta say, having negotiated a few contracts before, I was amazed at the statement that said that there were no concessions. None whatsoever? Zero? The union didn't agree to do anything, to make any kind of deals, concessions, compromises? You got everything you wanted?
Well, no, that's not entirely true. You know, not if you look at what we set out to accomplish, you know, we were looking for a positive head count to where they can eliminate jobs, like in Battle Creek, Michigan, where they're set to eliminate jobs. You know, we would have liked to have seen a little bit better on our retiree health insurance. But otherwise, you know, I feel like we got a pretty good contract. A lot of us are relieved to be going back to work. You know, I feel a lot of pride for all of our members standing up for what they believe in, what was right and just for the American workers. You know, I think this is a win for us, and I think this is a win for the labor movement around America. You know, I would like to touch on there, you know, we still have strikes going around the country. This isn't over yet. You know, this, like I said, this is a win for us, but you still have the UMWA coal workers striking against Met Coal in Alabama. Those folks have been on for 9 months. And, you know, like I said, we have to keep the labor movement going. And we have to keep pushing forward with that.
Let me ask you about the work that you and your fellow union members do. Can you just walk me through? The only thing I know about what it's like to work in a cereal plant is what I saw in like a Honey Bunches of Oats commercial. And I would like to hear from someone who actually does it. Like, if I worked in this line of work, what are some of the things that I might be saying, you know, I like this job, but this could be better, that could be better, that's too hard, that's not right. Like, what are some of the things that people deal with day to day that this contract is meant to address?
Yeah, this contract was basically meant to address, from our standpoint, the equalization of labors. We have a two-tier wage system where I'll be working side by side with employees who are making $12 an hour less than me, and we're doing the same job. The day-to-day operations in a manufacturing plant where we produce the cereal. I'm a mechanic, and it's very fast-paced. It's very hazardous. There's a lot of things that can jump out and hurt you. I myself had a major hand injury where I had 5 surgeries in 2015 on my right hand. We work 12 hours a day. We work 7 days a week to get it done. That's not what we were complaining about in the first place. That's what we did through the pandemic. Why they made record profits. That's kind of what started all this. Is we felt like we deserved our fair shake, our piece of the pie. So that's what we set out to do, and that's a lot of what we got.
I know I got to let you go in just a second, but 2 weeks ago, the company was apparently prepared to replace all 1,400 of the people who had gone on strike. President Biden publicly criticized Kellogg for that. And then Senator Bernie Sanders showed up at a picket line in Michigan. Here's part of what he said. Watch.
And I'm here today not just because you are on strike. I'm standing here today because you have had the incredible courage right here to take on corporate greed.
Before I have to let you go, what needs to happen now, both on the company's end and on the union's end, so that the next 5-year deal doesn't end with a strike? What's some of the groundwork that needs to be laid now so that when it's time to renegotiate, you could just kind of renegotiate and get back to work?
Yeah, I think from the union standpoint, we need to keep pushing the politicians. I'd like to thank Bernie Sanders and President Biden and all the politicians and all the community support that we've had, that we were able to stand strong and be able to fight, a corporate giant like that. But, we need to pass the PRO Act from the union standpoint. And, from the company standpoint, we have to prove our worth moving forward. We have to prove to the companies that we're worth what we get paid for. We're professional cereal makers. We've been doing it. I've been doing it for 18 years. A lot of people have been doing it longer. So we just need to continue to prove our worth and make sure that the company produces, and we're going to be a big part of that.
Right. And just to be clear, the PRO Act is the Protecting the Right to Organize Act. It would strengthen the laws around union organization. Daniel Osborne of the Bakery, Confectionery, Tobacco Workers, and Grain Millers International Union. Mr. Osborne, thanks very much.
Thank you, Josh.
Up next, America's population growth just made history, the slowest growth ever. We'll get the story behind the latest census estimates just ahead. Stay close. The pandemic slowed down more than the U.S. economy. It slowed down our population growth, too, dramatically. New estimates out today from the Census Bureau suggest that 2020 has the lowest population growth in American history. The population increase was just 0.1%. The Census Bureau chalked this up to a few reasons. There's less international migration, a declining birth rate, and increased mortality because of the pandemic. The report also reveals some interesting geographic trends. The states that saw the biggest drops in population were New York, California, and Illinois. These are, of course, home to our biggest cities, New York City, Los Angeles, and Chicago. Now, the people that left those states largely headed south. Florida, Texas, and Arizona saw the biggest increases in population. Let's dig further into those findings with Hansi Lo Wong. He's a national correspondent for NPR News covering the census. Hansi, it's good to see you again, and I wonder what your big takeaways are from the census data that dropped today. There were other findings in other reports and releases besides just this, but what were your big takeaways?
It's good to see you, Joshua. This finding from these estimates, and it's important to emphasize, these are estimates from the Census Bureau. These are not results from the 2020 census. These estimates are really just highlighting long-running trends that demographers have been tracking for years now, which is the U.S. is an aging population where there are fewer births, there are more deaths, and there is fewer immigration coming into the United States, less immigration coming to the United States. And these are trends that these are not new. And so it is not surprising to a lot of demographers who've been tracking this for a very long time that the Census Bureau's estimates would show this, that the population likely grew less than 1%, a tenth of a percent.
With regards to the population and the birth rate decline, that's been happening for a few years. Is there any sense of how much of that we attribute to COVID versus to other factors?
It's hard to say right now because this data is still essentially preliminary in that they are estimates and they don't really get too much into the why. But we do know that, like you said, this is an ongoing trend, has been happening for years now, and demographers have been seeing that compared to earlier generations in the United States, people are choosing to have children later in life, get married later in life, and if they do choose to have children, they choose to have fewer children when compared to earlier generations. So these are trends that have been happening for a very long time in the past decade, and so the question is how much did COVID amplify some of these trends?
In terms of the biggest percentage increases in population, the three top states on that list were three western states. Idaho, whose population increased almost 3%, Utah, whose population went up 1.7%, and Montana, its population also went up 1.7%. Any sense of what we attribute these increases to? I understand why people have been moving more to the south. I think that's been clear for a few years. But what about these western states?
It's a really good question, and I think every state has its own draws for folks, and people are moving for lots of different reasons. It could be for job opportunities, it could be for better housing, cheaper housing compared to where they're coming from. It could be for a lot of personal reasons, for be closer to family, or like you said, sometimes factors like weather makes a big factor. But certainly we're seeing places like Idaho that there are more job opportunities. Seems like that's drawing a lot of people from other states, and something that we've been seeing for a number of years now.
I do want to ask you, by the way, because the census has been in the news for the last few years because the decennial census happened last year. And there was a lot of concern over the actual collection of the census, efforts to change the way that people's immigration statuses were reported in the census. Where does all of that stand now? Has that kind of washed out, been resolved? Is that dealt with? Or are there still lingering issues with just the data and the concerns over the integrity of the census?
I would say, in short, the story of the 2020 census is not quite over yet. Counting is over. There was no question about immigration status, to be clear. And what the former President Donald Trump's administration wanted on the 2020 census forms was a question about U.S. citizenship status, which also was not on the 2020 census forms. The big question right now that I'm tracking is that a lot of states and cities, localities, local communities are getting their 2020 census results, these new population numbers. And they're looking at them, and some of them feel like they've been undercounted, which is a concern that always comes up after a census. And so watching to see if any cities and other local governments challenge the Census Bureau's results. One big program that's coming up is some cities can challenge how the Bureau processed the data collected for college dorms, for prisons, for group-style living quarters. And that is one program that we might see some an opportunity for local communities to say, hey, Census Bureau, you may have not gotten those numbers quite right. And what's so important to these local communities is that these Census Bureau numbers are tied to funding formulas. How much money, how much federal money these communities get is determined in part by these numbers.
Funding formulas, redistricting, which is going on right now. Definitely much more to discuss with the 2020 census in the weeks to come. NPR's Hansi Lawang, we appreciate you making time, sir. Thank you very, very much. We have learned a lot more from Sesame Street than letters and numbers. It's been on the air for more than 50 years. We'll meet one of the show's early stars and the director of a new documentary about the series before we go. This show, the one you're watching, might not exist if not for Sesame Street. It is one of the first shows that made me fall in love with broadcasting as a way to educate, connect, and serve people. It kind of shows in our design. We are on a street, after all. Blending these values into commercial television is exactly what made Sesame Street revolutionary when it launched in 1969. That is the focus of the new HBO documentary Street Gang: How We Got to Sesame Street. It tells the story of a show whose mission was both educational and political. Sesame Street started with a unique investment, $8 million from the Ford Foundation, the Carnegie Corporation, and what is now the U.S. Department of Education. The show took shape in an era of profound social change. Behind Big Bird and Kermit were people who stood with anti-war causes and the civil rights movement. Kids learned their ABCs and 1, 2, 3s while talking about grief, isolation, and racism.
And green could be big like an ocean, or important like a mountain, or tall like a tree.
And I remember thinking, are they singing about what I think they're singing about? Of course they were singing about race. But they were also singing about being down in the dumps because you're a little green frog.
The documentary shows how the African-American community played a unique role in shaping the show. A major goal was to give inner-city children of color the same educational opportunities as white children in the suburbs. The set itself is an homage to New York, specifically the historically black community of Harlem. Some considered that a gamble, a program to educate all children, but with a distinctly urban style. Street Gang highlights just how many people it took to make Sesame Street a hit. Artists working with educators, focused on treating children with respect. The characters they built reflected the real lives of everyday people. That may have been the greatest part of the show, and sometimes the hardest.
I had a great deal of influence in the creation of Maria. And John let me know that by rehearsing a script with me and then saying, would you really talk like that? And I said, well, no, actually, I'd say it like this. And of course, the writer's pulling his hair out, but...
Joining us now are Sonia Manzano, who you know as Maria from Sesame Street, and Marilyn Agrello, the director of the documentary Street Gang. Great to have you both with us. Marilyn, let me start with you. I watched the documentary. It is fabulous. It is hilarious. It brought a tear to my eye. It is wonderful in all the ways that Sesame Street is wonderful. But one of the things that I took from your film is just how much sophistication went into the show. I don't think that a lot of us realize how much Sesame Street was not really trying to sort of, you know, get one up over commercial television, but rather to learn from what kids were already engaging with in TV and use that to educate.
You know, it's really something. The people that created Sesame Street paired together educators who were at the top of their field with comedy writers who were from the worlds of late-night television and adult television. The writing was quite sophisticated and worked on two levels. They wrote for the adults and they wrote for kids. A great example of that is Monsterpiece Theater, which was a satire based on Masterpiece Theater, and adults loved it. And the educators behind Sesame Street knew that adults and children watching together would have so much more effect on the way kids learned.
Well, and Sonia, on top of that, not just savvy in terms of what happened behind the scenes, but also a real, tangible sense of activism among some of the people who created the show. I guess we don't think of it so much today. It's kind of like, oh, a nice environment where everyone's represented and everyone gets along. But when the show started, it was really, you know, no hyperbole here, it was really a revolutionary thing.
No, it absolutely was. I say this a million times. I watched television as a kid. I'm Puerto Rican. I never saw anybody who looked like me, who had dark skin, or even lived in a neighborhood that was similar to mine. And it would be shocking if you saw a person of color on television. So I was thrilled to be able to be Marie and be one of the first Latinas on television.
We also heard from another one of the Hispanic characters, Emilio Delgado, who played Luis. Here is part of what he had to say in the documentary about the images that he saw on TV before he made it to Sesame Street. Watch.
It was very difficult at that time to find meaningful work as Latino actors, you know. I don't remember ever reading for any kind of a positive character. I see you. The only roles that I could find were gang members or drug addicts. I realized I had gotten a role on television that was the role of a Latino, Mexican-American, who was like a regular person.
Marilyn, I don't know how you see the impact of this, but I think it's so remarkable now when, you know, everyone's got an opinion about what's on TV, right? But Sesame Street was able to kind of affect broader change by just existing as the change it wanted to see. It really was being the change it wanted to see and then influenced television around it.
Oh, absolutely. My favorite thing about this story really is that, yes, it's a story of Sesame Street, but it's really a story of a group of activists that came out of a period in our country when the civil rights movement was taking over. There was a protest against the Vietnam War. There was so many things happening in our society. And these people got together to create something that would really reach underserved children. I'm Cuban, and I appreciate in so many ways the way this show reached out to children to reflect to them people that looked the way they looked and lived in a neighborhood that they lived in. This had never been done on television before.
Sonia, do you recall in your time on Sesame Street whether or not that political aim, that more activist bent underneath the creation of the show, created conflict? I know there were certain stations, and you talk about this in the documentary, that had issue with the fact that the cast was integrated. But I know there were parents at the time, there must have been, who said, you know what, just teach my kid their ABCs and 1, 2, 3s and leave politics to their parents. Leave that out of it.
Well, I think people embraced both things. One of the most interesting and stunning things about Sesame Street as a kids show was that it said kids live in the same world that we do. Therefore, the television should reflect what's going on around them. And I think that Sesame Street did that very, very well. Of course, there was a lot of back and forth. There was a lot of backlash. We would have seminars and activists from the community would come in, and people like La Leche League, who were hell-bent on having mothers nurse their children, were saying that we should have footage to represent what their issues were. We would have people from the community, from the Native American community come in, and we'd have these rousing seminars, and they would demand what they wanted to see on television. So I always felt there was this marvelous kind of social, political tug of war. It was exciting.
Marilyn, how do you view the work that was done on Sesame Street in light of, say, you know, the landscape today? I take so much away from your documentary, as I took from Sesame Street as a kid, about television and what it could be, and I feel like there's so much that's applicable to 2021 as it relates to the story of the creation of this show from 1969, but I don't know if you draw any lessons from their story that we can apply today.
Oh, absolutely. These people set out to create something that was going to make a change in the lives of children. And one interesting fact about Sesame Street was that it was the first mixed race neighborhood of people that lived together. And it was actually banned in Mississippi because there were a lot of parents that could not accept this mixed race cast. While we were finishing this film, I was thinking of the Black Lives Matter movement that was on the streets of our cities in the summer of 2020. And it seemed like we're in the same place almost, that was in effect when Sesame Street burst on the scene in 1969. And I was so happy to be putting this film out at a moment when we sort of need, as a society, to be reminded of that we're all the same. And I'm very proud of this film, and I'm very proud that Sesame Street really has always tried to reflect this mirror to society without pointing a finger at it, without always saying, this is a black puppet or this is a mixed neighborhood. It just is. It just is. It's the way it should be in our real world.
And before I have to let you go, Sonia, I got to ask, do you ever miss Sesame Street? Have you kind of like moved on, made peace with it, or are there ever moments where you kind of wish you could go back?
Oh, I guess I miss it. There's always a little tug in my heart, especially when I saw this documentary. And Marilyn did such a splendid job of focusing on the artistry of the show and realizing that the art was what made the show so popular and live so long. So there's a little tug in my heart, but I think it's in good hands, and I'm happy to have been able to move on.
Well, look, I would be remiss if I did not say how much the show has meant to everyone on our staff, especially me. I mean, our backdrop is a storefront, a street, for reasons that I think go directly back to me growing up watching Sesame Street. And I think if you had not done what you did, I probably wouldn't be doing this, and I probably wouldn't feel the way about television and its impact that I do. So thank you. It means the world to me that you made time to talk to us about this and that we got a better understanding of the show and how it came to be. The movie is called Street Gang. How We Got to Sesame Street. It's streaming now on HBO and HBO Max. Sonia Manzano, Marilyn Agrello, I appreciate you making time. Thank you both very much.
Thank you.
Thank you so much.
Hey, thank you for making time for us. Come on back tomorrow and do bring a friend. Be sure to follow us online for the latest on upcoming topics and guests. We're at NBC Now Tonight on Twitter, Facebook, and Instagram. Leave us a voicemail if you like, 888-575-2NBC, or email us nowtonight@nbcnews.com. Until we meet again, I'm Joshua Johnson. We'll see you tomorrow. Good night.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.